something that you may consider checking when you have patients who are fall risk. A lot of times I will have nurses come to me as a nurse practitioner in a facility. Lisa, what can I do? We're exhausted. We have exhausted everything we can do. We are putting the patient in a low bed. We have mats next to the bed. We have alarms on the bed. We have alarms on the wheelchair. And we're still afraid this person is going to fall. What else can we do? We're documenting. We're concerned the patient's going to fall. We're concerned that we're going to have other issues involved. There's always the possibility that too many falls could hurt the facility and the reputation. So there's a concern. We want our people to be safe. What can we do? What I can do as a nurse practitioner and your providers can do for you, for your patients, is check a vitamin D level. Often that can be charted in the patient's chart. This patient has been a fall risk. You've worked up all the different fall risk assessment. You've tried all these interventions. What can we do? What can you do? What can you do as a provider? What can you do as a nurse advocate for your patients? What you can do is ask for a vitamin D level. You've already exhausted your whole entire protocol of trying to keep your patient safe, but there's something else going on, something physical. What can we do? By doing a vitamin D 25OH test, which is a blood test that can be drawn, you do not need to be fasting to draw the test. It can be drawn at any time, so if you get the order later in the day, it's still okay. You don't have to wait for the following morning and then worry all night. This patient can fall while you're waiting for this test. What you can do is go ahead, get that test drawn, get the lab result. What you're looking for is the key number of 30. If the patient is under 30, they're vitamin D deficient. Now you have something that you can work with. You can say, one of the reasons why this patient is falling is they have a vitamin D deficiency. The billable part for the vitamin D will be the diagnosis of a vitamin D deficiency or possibly some reference to bone degenerative problems. There's several ICD-9 codes. Your MDS nurse, who is very proficient in coding, will know which ones to select to bill to make sure that the patient's lab work gets paid appropriately. It will also make sure that the patient's medications will be paid appropriately. Now, once you've established that the patient has a vitamin D deficiency, you can continue or possibly restart your fall risk protocols, and that will buy you some more time while the vitamin D deficiency is corrected in the patient, which will help with having documentation if you need a sitter or you need a low bed or you need rolls to protect the patient from rolling out of the bed. There's an assortment of fall risk and your policies will go into effect. Once you've reached a vitamin D deficiency time correction where you go back and you do another vitamin D 25OH, which is the test you check for a vitamin D3. The body doesn't really use vitamin D2 and we don't test for vitamin D2. It's a vitamin D3 that you're going to test for. Once you have completed that test, then your provider can make a decision on whether or not you should repeat the test or go to a maintenance dose. You can document all of these interventions, and that will allow you a way to take good care of your patients and your clients and protect them from falling. Thank you. My name is Dr. Lisa Goins, nurse practitioner. I'm the CEO of Couture Healthcare Limited. Thank you for watching this educational, informational video. You can find more of these videos on YouTube. Thank you.